Hi, everyone. Welcome back to the Lights Too Bright podcast. Today, I have a guest who I've actually never met before. They reached out to me because of some really interesting, diverse work they're doing somewhere else. I'm not even going to tell you where they are so that you can listen and kind of figure, well, they're going to tell you what it is. So for those of you who are returning, please would ask that you like, follow and share the pod. And I'm going to go to my guest. So today I have with me Isma Tahir. Hi, Isma.
Hi, Kirior. Hi. Thanks for having me on your pod.
No, thanks for reaching out. I mean, like I'd said earlier, before we kind of started recording, it's really nice that you did reach out. I'm glad that I have an audience all over the world. And if you hadn't have reached out, I wouldn't have known that there was this journey to share, because what you do, and I'll let you explain what you do, is not something that is uncommon. You know, it is done, but
Absolutely.
I don't think many of our profession realize that they can do it and how to kind of get into it and things like that. So I thought you'd be a wonderful guest. And so why don't you explain to the audience, what you actually do? Well, what you're doing at the moment, I should say.
Well, I am dialing in from Islamabad in Pakistan. And I've been a qualified optometrist for over 20 years now. And about 7 years ago, my husband and I were off-roading in the mountains, and I came across some children that couldn't see. And this is where Sight Relief, my charity, started from. So I'm the trustee of Sight Relief. And basically what we do now is we are integrating primary eye care into rural, remote northern parts of Pakistan in the Hindu Kush, Karakoram and Himalayan mountains, providing lots of training to other health professionals, lady health workers, medical officers, clinicians, and building capacity within the community, because there is 2.2 billion people globally that are suffering from visual impairment, and 1.1 billion of those are conditions that can be treated. So I'm
So,
running as in the mountains.
yeah, that's amazing. So does that mean now, currently, you are permanently based in Islamabad, Pakistan? Or do you still, are you back and forth between there and the UK?
I have taken a 1 year sabbatical. So my interest is cataracts. And when I do go back in April, a year has come up so quickly. I worked in ophthalmology in the cataract clinic. So I do like pre-op kind of surgical planning and then post-op patients in Scotland's National Hospital, the Golden Jubilee. So that's it was really handy to have that, actually, because we do cataract surgery here in the mountains as well. So seeing different styles of work here, like high volume cataract surgery in low to middle income countries, is so different to the Golden Jubilee. But yeah, I kind of am back and forth. Answer to your question, I'm back and forth. But I started my sabbatical on the 1st of April last year.
So almost done. Okay. So that's amazingly interesting. So my Insta handle, my other Insta handle is Optomer Geek, and all this kind of stuff fascinates me. Being out there, and I'm assuming they're doing eckies on everyone when you do these grand things. Is it just whip the lens out, then put them into glasses, or are they actually doing IOL?
IOLs, we've got vehicle. The
Yeah.
surgeons are phenomenal, actually. And you watch them, like, they're just such pros at it. And the thing is that all the cataracts that we're doing are like grade 3, grade 4. So they're like stones, and they're
Yeah.
like dense cataracts, and they make it look so easy. It's phenomenal, actually. It's really, really good. But I think
That's
for me, sorry, were you going to say something?
That's just amazing. No, sorry, that's me. I should stop talking. This is about your journey.
Yeah.
I do like it. I got into, without talking about me, but I got into optometry because I like the health side of stuff, and so I find all of that fascinating. Why did you get into optometry? Did you always want to be an optometrist?
I think from a young age, both my brothers are -5. So from the age of like 5, 6, they're both younger to me. And I just remember all these endless visits to the opticians. And I was just curious. I was the one that never had any glasses, but always so curious at what's going on. So every 3 months we were in an optical shop, if it wasn't one brother, it was the other one that was getting tested. And then their reaction, I can see the score on the telly, and, just So, and just from a pair of glasses. So that is where my interest from optometry sparked. And
Yeah. Where did you do your degree?
Glasgow Caledonian in Scotland.
Okay. And then who would you have pre-regged with?
I did my pre-reg with Vision Express. So I started Vision Express in
Okay.
'99. I was still in
Okay.
school. I just got my place into optometry and I started as a wee optical assistant in there. And then I stayed with them for the duration of my degree and also did my pre-reg and then stayed with them for 7 years. I worked as a mobile
Right.
optometrist in the whole of Scotland. And then I did a little bit of locum work in England, Newcastle, and then I was in London for a while as well because it's a different kind of way of working, I think, down south than it is to the NHS system. I also worked in Stockholm as well. My husband got a job in Sweden, so we were there for 3 years.
Oh,
And
wow.
then,
Okay.
yeah, and then just off-roading in the mountains. This is what my husband loves doing in northern Pakistan is where the charity started. And just
Yeah.
looking into global health and what a big problem it is. It's just, wow, it's one of those things that I think we can treat. There's no reason why somebody should be blind.
Yep.
It's something that's preventable and treatable. And just because where you're born sight shouldn't be a privilege. It shouldn't be about, you can get sight because it's all about access. So the areas that we go to are
Yep.
so remote that we're off-roading and we end up camping in those places because there's nowhere to stay.
Okay. So, like, how do you start a charity? How, like, do you just, how is that process? Because that fascinates me. Because I think what you've said, I think
Mhm.
will resonate with a lot of people, especially considering the state of the world at the moment and people who are suffering in all regions of the world. And there's going to be optometrists, and most optometrists go into optometry because they want to help people see, not
Absolutely.
the retail element is not their primary goal. It becomes a lot of what we do, but it doesn't tend to be their primary goal. But yeah, so how do you start a charity? How do you raise funds? How does that go about?
It's been a huge learning curve, and I'm still learning as we're going along. I think actually it was COVID uh, that made me sort of set up Sight Relief because up before COVID we were working for 2 years on the ground, and then all of a sudden I felt helpless. I'm like, oh my god, I can't do anything. There's all these people and what we're going to do. And, I just did some research and I looked into all the different charity regulators and being in Scotland. So I'm Oscar registered and literally put in an application about all the work that we do, what our mission is, the objectives, and got approved as an Oscar registered charity in 11th of August 2021. And up until it's thereafter, I've started doing some fundraising. It's all
Okay.
so far been with friends and family. But
Yeah.
now our projects are getting much bigger. I mean, to date, we've seen about 20,000 patients. We have done 500 cataract operations and 10,000 specs and over 9,600 something eye drops. As the need is getting bigger, as we're now integrating primary eye care into the current health system using the World Health Organization's primary eye care framework. And we're hoping to maybe even look into doing a RAB study, which is a rapid assessment of avoidable blindness. So now this is where the funding part of it starts. So it's literally just applying and looking for whoever is willing to fund and support us. So I think to date I've had 2 big funders, but
Yeah.
other than that, everything happens with just friends and family so far.
Okay. So prior to charity status, how were you doing it then? Were you just going out with your friends, people you knew, and going, right, this is what we're going to do? We're going to, did you have like local support? Does that make sense? Because
Yeah,
the
absolutely.
logistics of it fascinates me.
Yes.
You know,
So we located a surgeon first. That was the first thing. When I had identified like 50 cataracts, I was like, right, oh my God, who's going to do these? How are we going to get them to see again? So I did some research and and just visited some clinics and just reached out, and I found a lovely ophthalmologist in District Haripur, which is where I'm now doing a pilot study in as well. So he very kindly, all he's taken is cost. I think is the initial surgeries he was doing was £30 an eye. There was an optometrist who was working for him at the time, but she was just doing part-time work in his clinic. And then I was like, would you be interested in going out? And so what we did was large screening, what they call eye cant. So you
Yeah.
turn up a village, you make an announcement, and you've got a couple of hundred people turn up, and you can check their vision and all the rest of it and give them glasses and so forth. So it started off with one optometrist through my consultant, and then I advertised for students on Facebook. I was like, whoever wants to get experienced in the field and do refraction and work with a UK charity, come along. So my team has grown from there. Really, I've now got 15 members in my team here in Islamabad, and it's all about, for me, it's about giving opportunity to the youth as well, because it's a really weird system because
Yeah.
they don't have a governing body in Pakistan. The optometrists, the burden of curable blindness is huge, but yet optometrists can't get a job. It's quite
Okay.
complicated. It's pretty, but we're trying to
Yeah.
work with the government and then try and get a governing body for those optometrists. But we're working with district health officers and the government to now enable optometrists to be in the local health centres. So that's what we're working on.
So in Pakistan, what's the scope for optometry? Is it still kind of early level refraction, or are they now doing more slit lamp and not necessarily disease management, because in the UK it's only we've only just got there, but in terms of diagnoses and referral, is that kind of where you aim for them to be?
So
Because if it's yeah.
yeah. So all the optometrists I would say in Pakistan who've went to university and got their BSc honours and got their degree, they can only work under an ophthalmologist. So they are clinically sound. They are into disease management. I would say a newly qualified optometrist in Pakistan who's been on the field for 6 months is phenomenal. I mean, I'm late into my career now, 25 years in, and I've got some young kids, that are like mid-20s, 25, 30, and their knowledge is phenomenal because they're seeing things that you and I studied in a textbook, and we've
Yeah.
never got to. So, like, to be able to see stuff 20 years later, I'm like, oh, I remember that in Kansky, that for me is
Yeah.
what's keeping me going as well now. I'm just like, oh wow, I did, pterygium is nothing. You get it all the time. There's so many things. So the optometrists here are far more trained to manage disease and to see lots of unique cases. Yeah.
And then is it still your same ophthalmologist, or do you now get more ophthalmologists in? I guess to do that number of surgeries, you must have a bigger surgical team as well as optometry team.
Yes, we've had some ophthalmologists in from the Punjab region as well, and Karachi. So other provinces have had other ophthalmologists that have come in, because there's two types. There's ophthalmologists that just have their own private clinic and they work in a clinic, and then you've got a set category of ophthalmologists that all they do is they just go and do high volume, and they're kind of almost mobile. They will turn up
Yeah.
and I mean, last year we were at a place called Bhuni, which is Upper Jadral. So it was like a room, and we had to turn
Yeah.
that into a theatre within 24 hours. But they're so slick, they're so used to doing it, and when they're mobile microscopes and phaco machines and whatnot. Yeah, so that's the
I
two.
mean, like I said, it's absolutely amazing. So, because I'm fortunate enough, I think I have a reasonable audience. If someone wanted to reach out to you and maybe come and volunteer or kind of donate to help you guys out, how is that achieved? Do you guys have a link, website and stuff?
So I've got a website.
Uh,
It's not that great, I must admit, but because right now it's been me trying to manage everything. But I do have a website called site-relief.org, and we're also on Instagram, media_site relief. For the last few years, I've actually had some volunteers coming out. We've had Dr. Andrew Blakey from St Andrews University. He's the
yeah.
Premier Eye Care global health expert. He's come out and helped me deliver training to lady health workers using the frugal, innovative device of his, the ArcLight, which has been a game changer, actually. That's been absolutely phenomenal. I've had two people who are not even opticians. They have come out and helped with traffic management and coordination of a mass screening camp. So check out, just drop me a DM, and we've got another big project happening in June this year up north. So, yeah.
I mean, like I said, amazing, amazing it 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 fascinates me, and if this doesn't inspire optometrists um, to do different things, there's nothing wrong with being in a consulting room. But sometimes being in a consulting room, you're not aware of the opportunity and what you can give back to communities, not necessarily just the one you live in,
Yeah.
but other ones around the globe. So so now I'm just a bit curious. So you did your vision, this is just jumping,
Yeah.
because when did you did you did your time with VE, and then what made you step away from that? Was it looking for a new challenge? Was it you got bored? What made you step away from VE, which it's a nice role?
It's a nice role indeed, yes. I moved to Newcastle. There was some family commitments, so we had to move. And then I think there was no Vision Express vacancy as such within Newcastle. So I thought, you know what? I'll try locoming for the first time. And at that
Yeah.
point, I had 7 years experience within VE and working as a mobile. So I was used to kind of moving around and going into a different practice. But locum was totally different because I was like, whoa, it's not just a different practice, with the same computer system. It's a different computer system for each of the practices. And what I found through locuming was that I absolutely loved working with smaller independents because it was more clinical. There was opportunity for me to teach as well. I love teaching. I love training. And that's hence why I'm still training just now. Uh, So working with the little independents let me increase my clinical skills, let me do more diagnostic tests, which you're sometimes limited for time in the larger multiples.
I agree. I'm an independent, but I think locoming, it does teach you a lot of skills as well.
Absolutely.
It can really help you diversify in terms of finding different areas of the profession that you might enjoy. And but also you do have to be you have to be comfortable being independent, because there's not necessarily that fallback of someone to pick up the slack. And that's definitely a positive of locum. And also, I mean, the pay's pretty much better as well for the most part. So that's always good. So you went from Newcastle, and th- then what happened in Sweden? Like, how were you able to work in Sweden?
And so to work in Sweden, you have to be able to speak Swedish at university level. So in 3 months, I learned Swedish. I went to Swedish school Monday to Friday. And because you're living in a country, it was easier to learn the language. So
Yeah.
I was able to speak really well in 3 months, but my written Swedish wasn't that great, which you need for medical records, clinical records. I managed to find a Specsaver's partner who was studying optometry. He was doing a master's in optometry to become like the UK level optometrist. In Sweden,
Okay.
the optometrists only do refraction. They don't even do cyclo. They send them to an ophthalmologist for that. They do no health checks, no VOC, no ophthalmoscopy,
Yeah.
none of that. So because he wanted to learn all those skills, and because I wanted to teach and I wanted a job or needed a job, it worked great. He let me work in his practice, and I almost worked as a pre-reg for him. So I did the testing in my Swedish that I knew, and he signed off the work
Yeah.
in exchange for me teaching him slit lamp, Goldman, Vogue, how to interpret a fundus photo, how to interpret OC. So it was fab. I loved it. And then on the odd occasion when I did get patients coming in and I was like, oh, this Swedish is above my level of Swedish, I'm just like, yes. And then I would
Yeah.
get somebody over to help. So it kind of worked really well.
There is a lot to be learned from working with a colleague like that. I think, particularly, when I ended up working at Tompkins Knight and Son, I'd already been qualified 15 years.
Right.
So, I wasn't new to the industry, but I worked with Brian, I worked with Deborah, and we're a small team. And I'm
Mhm.
like, well, I'm learning stuff,
Yeah.
even though we were same nationality, same practice, we were just learning something new. And we get a lot of students in who come in and sit in with us. And you kind of sit there and you listen to them and you go, oh, actually, that's quite interesting. I never thought of it like that. And so it's nice when you're teaching, you do have to keep on your toes, make sure you're keeping up. But it's nicer if it's back and forth learning rather
Absolutely.
than just one way traffic where you're just preaching to your audience. about how it should be. But I mean,
Absolutely.
that's amazing to have got. So 3 years in Sweden. Wow. I mean, so you've done it all. So any other countries you've worked in? So you've done Scotland, you've done England, you've done Sweden. Now then you're back to Scotland,
Yes.
and now you're in Pakistan. So when did you end up back in Scotland, and how did you end up in a hospital clinic?
So when COVID hit, we moved back to Scotland for our parents just to be there for them. They needed that support.
Yep.
And, a lot of elderly were feeling vulnerable. And my husband and I made the decision to move back for them. And when I moved back, it was a colleague of mine actually from Vision Express. And he said, Isma, you know how you've always wanted to work in hospital? And I'm like, yeah. And he's like, oh, well, there's this position that's come up. And so I applied and I got the job and it was great. I absolutely loved it. So I was 3 years at the Golden Jubilee and I learned so much. And again, to learn so much, I don't think learning really finishes. You know how like you think like I remember when I was a student, I remember talking to a senior optometrist and she said, oh, you know, you've got a lifespan as an optometrist of 10 years and then after that you'll just want to retire. But I totally disagree with that because like 20 odd years in and I'm still learning, I'm still finding different things. Like only 4 years ago I started the Jubilee and the amount of stuff that I learned in my first year there, I was just like, oh wow, like I can quickly look under the slit lamp and be like, yeah, this, whereas before you'd be like,
Yeah.
I guess in a busy practice when you've got so many patients, 20 odd patients or something, you wouldn't even look out for a fix or
Yeah.
just small things that are important. If they're not small, they're important.
I think the profession has the ability to get boring, and I think you can get bored of it, but you get bored if you just stay doing the same thing. So I do glaucoma clinic, and when I first started glaucoma clinic, everything was amazing, and now it's all a bit same because 20 years in, you've seen most of it, right? But then there are so many other things you can do. You can start a podcast, you can start a charity, right?
Absolutely.
You can go into the really rural areas of anywhere in the world and find a way to help people. And then all
Absolutely.
of a sudden, the profession is not boring anymore.
Absolutely.
And where you're in a situation where you're just trying to sell someone some kind of refractive solution, okay, you're
Mhm.
going from that to changing lives. And, you don't actually even have to go to rural Pakistan to do that. You can work in a cornea clinic, you can work in a cataract clinic, and just by virtue of having someone surgery, fitting them with a scleral lens, a complicated contact lens, the ability to change lives that we have of optometrists, I think is a bit underestimated, a bit undervalued, because unfortunately we do still get thought of as refractionists and providers of spectacles, or kind of daily disposable contact lenses. I find it amazing what you've done. I complete honesty, because it's my podcast, so I can be honest. When someone reaches out to you and you're like, oh God, they've reached out, they've got a good story. But is there going to be an angle, right? And I guess people do that when I reach out to them and ask them if they'll come on the pod. But it's just so amazing to see how your journey, and what you were doing. I think it's so like honorable, and it's amazing. So well done for doing what you're doing, and taking your time to do it. Amazing. Thank you ever so much. I really, really appreciate you taking the time.